He made it look. That's why his hair. Look at his hair.
Fell out.
It spiked. It spiked. The coffee. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com's website. Check it out. Here today with Mike. What's up, Mike?
Nothing, Buzz. I'm just excited to be back here again. I do love participating in this show. Of all the shows that I'm involved in, this is like one of my favorites.
One of.
Yeah, one of. No. Actually, this is probably the highlight. But I do like listening to the testimonials that you have on here. It's really cool to learn this stuff. That's the way I'm always prepared. Is I'm always sitting in the back of the room and I can hear people and I'm like, I got this down pat.
You own this stuff.
Stop kissing up.
Anyways, we're going to cut the break and we'll be right back.
Let's kiss it up. Okay, ready?
Ready.
Take a drink of coffee.
Done. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com's website. Check it out. And I'm here with Mike. And Mike, I'm getting ready to fly out of town. I'm flying out of town tomorrow. I'm going to Houston. I've been asked to speak at a convention in Houston on stem cells, so I'm pretty excited about that. And basically what we're doing is we're training other medical providers how to implement stem cell procedures into their practices. So the cool thing is it's gaining some traction, right? More and more people are doing this, but they want to, luckily they want to do it the right way. I think I mentioned one of the previous shows, what's happened, there's been a huge shakeup in the whole regenerative medicine world. And basically what happened is one of the stem cell products on the market that I've talked about for the past year that I said that we never would use at Buckeye because I didn't think it was a compliant product and it was the wrong product. There was a blood stem cell product that basically got pulled off the market, and a lot of MDs were using this product. So these guys are scrambling to find the right product. So I'm trying to help them out, and I'm coaching them up on to use the products we've been using at Buckeye for the past 3 years, and that's the umbilical cord tissue product, which is a much better product. So just to clarify the difference, so there's umbilical cord blood, and then there's umbilical cord tissue, which umbilical cord tissue is really called Wharton's jelly. And there's a huge difference in what is contained in these products. So umbilical cord blood is literally what I was saying. It's the blood. There's two umbilical arteries, one umbilical vein, and the blood's very inexpensive. So companies were harvesting that blood and then processing it, and they were getting stem cells out of this product. But the problem is it was the wrong type of stem cells for orthopedics. Umbilical cord blood has a lot of hematopoietic stem cells, which are blood stem cells, and epithelial stem cells, which are skin stem cells, which do nothing to heal joints. But as I said, it's very inexpensive to process, so that's why these products are being sold. But an issue came up with cord blood. Obviously, blood products in general have what they call HLA matching. There's antibodies that your body's that are produced in blood. So that's why when you get a blood transfusion, they test your blood type, and you can only get in certain blood types. You can't, if you're type A, you can't have a B, right? Because you'll get antibodies, you could die. They had an antibody reaction with one of these products. Nobody died, luckily, but there was a reaction. Yeah, so like I said, these products are now pulled off the market. I actually work with the company Regenerative Labs. They're out of Florida. I'm their director of implementation. So basically what I do is I'm the liaison between the manufacturer and the providers to make sure they implement this product properly. And they had me going to Houston to speak on their products. I'm pretty excited about it.
I have a question about that. So the people that you're going down to talk to are not just people that own clinics like you do. They are also medical physicians, right? So you are kind of
the majority.
But that's what I think is really cool about it, is that you were so far ahead on this product, putting it in your practice, that doctors now are coming to you, whereas, if we looked at this 3 or 4 years ago, doctors wouldn't have had the knowledge behind it, and they would have said, you need to stay away from it. You were doing the future of medicine years ago, and now you're getting to teach. That's what I think is really cool, and you're being, shuttled around the country, because you just went to Memphis, didn't you?
In Memphis, I'm going to be...
you went to Mississippi, too, I think.
Tupelo, Mississippi, get it right.
Well, listen, who is not familiar with Tupelo, Mississippi, and their stem cell regenerative seminars?
Elvis, yeah.
But you're going around the country doing these talks and teaching people. That's what's cool about it, is the people can go back and listen to this show for 2 years, and they'll hear you talking about these things.
You're saying don't use cord blood, use cord tissue, don't use amniotic fluid, all the things we're talking about. And everything's going to work itself out. And at the end of this, everyone's going to be using umbilical cord tissue like I was telling them to do 2 years ago. And I think, what I've been lucky at Buckeye is, myself and Dr. Beynen are the only fellowship-trained physicians in the state of Ohio with stem cells. And we also have more experience. We've done over 1,000 procedures at this point, so we have a lot of clinical experience.
Can I ask you a question about that? So you've done 1,000 through Buckeye.
They've done over 1,000 at this point.
But, so let's just say it's over 1,000. The average MD, how many do you think that they've done? Because we've talked about it. You wouldn't go to somebody, like you always say, your check engine light. If that was on, you wouldn't go to your guy down the street. You'd want an expert that's done this over and over again that can identify this. MDs, they're not in the practice of doing this, right?
Yeah, so what you have to realize is medical schools don't teach about stem cells. Like, you might get it in biology, like we all do. Like, you learn about it, here's what a stem cell is, but there's no formal education on stem cell procedures, how to do them properly. So if a provider hasn't gone through a program like myself and Dr. Beynen has, and no one in Ohio has, then their only training they get is a sales rep will come in and say, hey, listen, buy this product, and this is what's in it, and most of the products out there aren't even independently tested. So you really don't even know what the heck is in this thing.
Right.
And put it in a needle and stick it in your patient. Like, well, it just doesn't work that way. That'd be like selling someone a pacemaker, and you've never had training on it, and say, all you gotta do is cut the chest open and stick the wires in here, and it works great. Like, but no training. That's how crazy it is.
Well, I feel like it's the new drug rep sales tactic. Like, it used to be not to pick on one product or anything, but it'd be every doctor their notepads would say like Flomax or whatever it was, and you know what? It just happens to be you need the product that I'm using their pen and their pad. This is what I need. Drug reps were able to influence the medical industry to buy more of that product, and it wasn't the generic product. It's capitalism, right? And that's kind of where you're at now.
It's funny you're having this conversation. So before I got here, I was late, but I'm always late. But I don't want to drop a name, but the president of one of our larger states' medical society, I was on their pain society. I was on the phone with him, and and this is the head of the pain society. So he's the head of all the doctors. There's over 1,000 doctors in that state that do pain. He's the head of them. And I was speaking with him for about half hour on the phone. He's like, I learned more in that half hour talking to you than the last 7 years of BS I've been taught by all these sales reps. And he goes, I'll be frank. He goes, usually they're really pretty girls that come in here and they bring us food, and I bought into that. And I feel a little bit guilty now, but now I feel good. So, but that's
and he's full because he had lunch already.
Right. So, just because unfortunately, most of what doctors, at least with the stem cell arena, there's no education. So if your doctor's doing this, I always ask, number one, what formal training do you have? And formal training doesn't mean a sales rep came in and showed you how to do it, or I went to a weekend seminar at a golf resort in Florida and they showed me how to do it, because that doesn't count. Like, what university accredited program did you go through? No one in Ohio has been through that. Nobody. If you haven't had formal university training, why would you trust this person with your health?
Right. Well, I think,
and I don't care if they're a orthopedic surgeon. It doesn't matter. They weren't trained on the stuff.
Right.
Right. I mean, an orthopedic surgeon is really good at doing orthopedic surgery, but that's not stem cell procedures.
Well, the other thing about the orthopedic is, we've had this conversation off the air, is that they are trained to do, like, they are looking to do surgery.
100%.
Right? Stem cell is not to do surgery. It is to prevent surgery and to get you to optimum health. Versus a surgeon, their job is to cut. Right? I don't mean to make it that base, but that is.
No, they're really good. And there's certain situations you need to have surgery.
Right.
Now, I want to know a good orthopedic surgeon. There's some situations you're going to need surgery, so it's not all doom and gloom. But
if it's on a
they're
knee
not
or
set
a
up
shoulder,
to do this. They mean, if you need surgery, you go see an orthopedic surgeon. If you need stem cells, don't go see an orthopedic surgeon. Go see someone who specializes, like Buckeye does, in stem cell procedures. Right. And the same thing, it happens all the time. We've been doing hormones for 5-6 years. I don't even know how many years. A long time.
At least 6 years, at least.
We have thousands of patients at this point. And I still hear it every week. Well, my urologist, my endocrinologist, and not slamming those professions, because these guys are very smart, but they don't do bioidentical hormones. So it'd be like coming to me and asking me if you need a filling. I don't know. I'm not a dentist, right? You're asking the wrong guy.
But I'll still give you advice anyway. Go get it.
Maybe, yeah. No, but it just doesn't make sense. My mom had a situation yesterday where she thought, and it was nothing, but she broke her ankle. So when she broke her ankle, obviously I sent her to an orthopedist to make sure she didn't need surgery for it, because we can look at ankles, but I'm not a specialist in broken ankles. Right. And she had a situation yesterday where she was wearing her cast too tight, I suspect, her foot swelled up. So she's worried she have a blood clot. Well, I'm not a vascular surgeon, so I was like, you need to go to the hospital. That's not what I expect, I don't think you have it, but I'm not 100% sure. That's just an example of, if you're not sure, refer out. And it just drives me crazy because, endocrinologists or urologists will, or my patients will go there and they'll say, well, they don't agree with what you're doing. What training do they have in this? How can they even judge us? How many patients do they have under care?
I look at those doctors almost like they're kind of like goalies. Like,
and it's not all these, but I'm not canvassing all these, by the way.
Right, we're not picking on them. It is a matter of they know what they know. But once you test the limits of what they are experienced at, they don't refer out to you, right? So you're referring people to an orthopedist or to their MD, but they're not kicking it back to you because they aren't trained, but they also don't know. They don't know the outcomes of these. They don't know anything about stem cells, where they come from. That's the problem, is you guys have to do so much more work to promote what stem cells do. I mean, you've had, I can't even tell you how many seminars, probably just here locally. You think you've had like 40 of them this year?
And people always ask, why do you do seminars? Well, there's no other way to get the information out there.
Right.
You're not going to see any commercials on TV. You're not going to go to your GP and say, hey, try stem cells. If you go to your GP and you're in pain, just send you to pain management. And if it's a knee pain or joint pain, they're send to the surgeon, right? I mean, so if I don't do lectures, if I don't have a radio show, if we don't do commercials, no one even knows.
Right.
That's a crazy thing.
Let me ask you this. So I know a lot of people will call the station here on a Monday after the show's aired on a Sunday, trying to track you down. The people that are coming for the stem cell...
I'm always hiding.
Oh, that is absolutely true. If you want to find Buzz, don't use the phone. But when people are coming to you, is it more they're curious, or they've done some research on their own, or how are they getting into the stem cell program?
I will say, which I like, the stem cell patients seem like they've educated themselves a little bit. Like they do a little digging online, which is good because they have some background knowledge. And at the end of the day, even when you come to the office, we evaluate to see if you qualify for care, but the majority of the time is explaining how this works. Because if you don't understand how it works, you're not going to get how it could benefit you, if that makes sense. So the seminar, if you come to one of my seminars, I spend an hour just explaining how it works. I don't tell you if you can qualify or not, because I don't know. I'm not going to diagnose you at a library, a restaurant.
Right.
But this is just how it works, and if this is something that makes sense for you, you should come and check it out. And if it doesn't, then don't come and check it out.
But the first step is to go to the seminar, or you could just come in. I mean, the seminar is probably the best way to see it because it's all broken down.
Just come. But the other thing we put in place is you can come right to the office. We don't charge you for the initial consult because I don't know if you're going to qualify or not. I can't charge you $200 for something that it say, hey, you thanks for your $200, so you don't qualify, right?
What would be the steps though that somebody has to go through? Do they need to do the blood draw first, or is it more they tell you here's my symptoms? Because you said a lot of people will research it and they'll say, here's my symptoms, here's how I feel, here's how my shoulder and my knee, whatever. Because you're not diagnosing literally just for stem cell, you're looking for overall optimum health.
Correct. And sometimes people will come in and they think they need stem cells and they have a disc injury, we do laser decompression, or they have peripheral neuropathy and we use a Tesla Max on them. So so we get people coming they think they need stem cells, or they might want stem cells, and they actually would benefit from doing some other type of technology.
Whereas if they're seeing that, we talked about this, I want to say 2 or 3 weeks ago, that group that comes out of St. Louis, that they go to an MD and they're gonna.
Oh yeah, there's a group. There's a group out of Atlanta that come in. They fly into Columbus once a month. And they do a seminar on a Monday, and then or Monday or Tuesday, and then they literally the staff works the office for 3 days afterwards. So you go in there, and guess what? Everyone needs stem cells.
Right. Every single person. Yeah, you qualify.
Yeah,
based on what? Because you showed up.
And guess what? When you go back a week later, they're not there. Mm-hmm. Or you got to call Atlanta and say, hey, I'm having this problem or that problem.
So there's no aftercare at all for this.
No, and it doesn't work that way. If you need stem cells, there's 6 weeks of aftercare that is included in the package that is absolutely mandatory to ensure success. But just dumping stem cells into a joint doesn't fix a joint.
Right, because there is a process you have to follow. 100%. But you guys have laid that plan out for people, right? So in that 6 week period, there's follow-up. It's not come back in 6 weeks, right? You kind of have like
you're coming once a week for 6 weeks at least to ensure that the cells are viable, that they lay down their scaffolding, and we actually get a result.
Can you tell a story without naming names? You've had a few people that you've told me off the air that have had such great results, especially I'm thinking of somebody specific, and because we're on the air I can't say their name, but that was having a shoulder issue, that was trying to put off having shoulder surgery, and they ended up using stem cell. I think he was like one of your original kind of let's test it out on him.
Oh yeah, okay, yep. Yeah, this person here was actually he was scheduled to have bilateral shoulder replacement surgery. So they were just going to cut the balls off and start from scratch,
right.
Which is a pretty big deal. And this person here, I want to say, is in his late 40s.
Yes.
You know what I'm saying? So then you got to figure this guy's in his late 40s. He does manual labor. So those shoulders would probably last 10 years. So he'd have to do them again when he's in his late 50s, late 60s.
Which hurts even more as you get older.
Yeah, so he was one of our guinea pigs. You're right. He was a guinea pig.
Well, I didn't want to say guinea pig, but I was trying to think of a nice way to say a guy you experimented on. But the only reason I knew of him from a previous life when he was probably in his late 20s and 30s, and this guy was always a hard charger, always working hard, and his shoulders were just wearing out on him.
Yeah.
It was to the point where I think he was seeing you for chiropractic issues, but now he needed this next step because otherwise...
His wife actually worked at OSU, worked at a hospital, and they were going to do the surgery there.
Right.
Yeah, so it was kind of...
But basically, he was looking at 6 to 9 months of rehab on each shoulder. But how are you going to work? How are you going to function? It was taking away his everyday pleasurable activities, going to the gym, and just he loves what he does for a living. And you were able to spare him that surgery.
Yeah, no surgery. He's doing great. He's working out again. His job is very manual labor heavy. He uses his arms a lot. So, didn't miss a day of work. Kept cranking.
But that was one of the first guys. Yeah. I remember because we did the show here with him, and he was telling me all about it, and I thought, that seems really, like, ahead of the game. And he said, what's the worst case scenario? I have to have surgery after I have this? He's put off the surgery, and that was like a year and a half ago.
Yeah, that's a good point. People, ask, is there any contraindications or situations where you shouldn't? Well, number one, stem cells only work if you do them. So if you don't do them, you'll never know. And we only will do the procedures on people we know we can help. So if you don't qualify, we're going to tell you. We won't accept you as a patient, right? And the other cool thing about these products is, unlike, I think people always think too, like we're so used to the medical model where you're getting cortisone or Synvisc, which are medications, and medications never last. You're not fixing anything, right? So I think people have this fear, well, if I get stem cells, I have to get stem cells every 6 months, every year. It doesn't work that way. These allografts that we put into the joints gets the body to heal itself. So the procedure should last the rest of your life. It's not like something you redo every year or every 6 months or every 4 years.
Right.
So these procedures last the rest of your life.
I remember there's a guy that I will say is a friend of ours that worked in this building and was having chronic knee issues. He used to play football and all that. And he asked his MD about things that you do at Buckeye. And that doctor it wasn't that he was saying you were wrong. It was, I don't know enough about it. So what did he do? He kept getting cortisone injections in his knee. And he's, I think, early next year scheduled for knee replacement. But how long did we talk to him about it? At least 2 straight years, because it was a noticeable limp. It would get better. He would wear a knee brace. Like if you're wearing a nice suit, and you're wearing a knee brace to work, you better be collecting money for somebody or something, because there's no reason for you to walk around like that. But he put it off, and then it got to the point where it's beyond repair because he delayed in taking action.
Mm-hmm. And that's what a lot of people, what you have to realize with your health is, a lot of people will say they want to wait for, I want to wait till I retire and all this. What the hell good is retiring if you're immobile and your knees or your shoulders or your back hurts? Like, what is this?
I don't know if you said that last week or the week before, but you did bring up the fact these people want to wait till they're 55 and 60.
I hear like probably once every, like once a month, people come in and say, I want to do it, but I want to wait till I retire. Like, what are you waiting for?
Right. You're just sitting in a chair all banged up. And a lot of people that when they retire, their quality of life, they're not kind of working backwards where here's the result that I want. It is, I'm going to put up with this until I get to this point and everything will be fine. Well, if you don't feel well, if your body's banged up, if you don't take care of it, you have nothing to look forward to.
If you don't have your health, you don't have anything.
Right. So now you have all the free time and you have bad health and you're 65 years old.
And that's probably 50, 60, 70% of people who are retired. Like, how many people are retired and really enjoy the retirement?
I don't
or out there
know
riding bikes or walking their dog.
That's the thing. I never see it except on commercials. You always see people with their wife or young girlfriend walking the dog and all that. But they look like they're 70 years old, living the best life they're ever having. But
that's not reality.
That's not real.
That's not a reality for most people. Unfortunately, they, because of hormonal issues, they'll put on weight. They can't fight inflammation. Their joints wear out because of lack of stem cells. Then you get to this thing called retirement. And what is retirement? Retirement is sitting around in pain all day long.
Right. Versus going to work and being in pain.
Right.
I think people associate pain with work. Like, I'm going to tolerate this because it's just part of what I do. And I don't even care if you're an accountant or what it is your job is. I think they just think, mentally I'm worn out. That's why my body feels this way. You don't have to live like that.
Yeah, if you have pain is inflammation. So anything you have that hurts in your body, that means you have inflammation there. Inflammation causes tissue to break down. So if you have pain anywhere in your body for 3 months or longer, you have a degenerative joint condition. It's that simple. So if you wake up for the past 3 months, your back hurts every morning, your knee hurts every morning, I guarantee you take an x-ray, the joint's wearing away. It's kind of like you have a cavity, we'll say.
Right.
And we all know if you have a cavity and don't do anything about it, it gets worse with time. Every single time, right?
And it's because it's down.
Yeah, I mean, and the same thing with your body. So if you have chronic back pain, chronic knee pain, chronic shoulder pain, it's not if, it's when you're going to have to replace that joint. Or if it's your back, fuse your spine.
Right.
So, obviously the sooner you address this, the better the outcomes are. And it doesn't cost anything to come to the office and get checked out.
When you're talking to people about these procedures, do you think they hold off because of fear? Because it doesn't seem to be a lot, especially when we're talking about HRT or these other programs. When you're dealing with bioidenticals, it's not really the cost of it. It's more, either they don't understand it or they're afraid it's going to hurt or whatever it might be.
I don't think it's a fear of pain. I think it's what I hear or what I think is almost too good to be true. So what you're telling me that I'm 50, I can feel like I'm 25 again. Wait, you're telling me that my knee is I'm supposed to have knee replacement surgery and my knee to be normal again? And the answer is yeah.
Right.
Yeah.
But I think we live in a culture, again, we've talked about the drug rep situation when you're seeing stuff on TV. If I see Frank Thomas on TV and he says, all you got to do is take these pills that I'm endorsing, blah, 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 and you'll feel like you're a kid again.
He doesn't look that good, by the way.
He does not. He looks like he's eating a lot more than those pills. But when you're talking about stem cell, yeah, he's mixing that in. But when you're talking about regenerative medicine, that is not just the future of medicine. That's what's going on right now. So if people are going to put off those people that are putting off waiting to do this stuff to fix what's wrong.
But technology is not going to get any better than it is right now. We're on the cutting edge. We've been using the same products for over 2 years now with the umbilical cord tissue product, and there's nothing better. There's no other place in the human body that has more of what they call these MSCs, mesenchymal stem cells. So there will be no better technology. And and we also have a very effective way to get oxygen to the joint by using ozone injections, shockwave, and laser therapy. So your ability to heal, if you're waiting for some better technology, it's not going to happen at this point. What we're teaching now is what's going to be here. This is going to be the gold standard for the years to come.
So in the last couple of minutes we have, if somebody's out there and they're debating, should I do this or not? Should I put up with this pain or not? What would you say to them if they're listening right now?
Why wouldn't you? Or people say, how would it change your life if you didn't have your back wasn't hurting every day, if your knee wasn't hurting every day? How would it affect your life if you ever sleep a full 8 hours a night? How would it affect your life if you got home from work and felt like going to the gym or playing with your kids? How would that change things?
We should have done that as a commercial. I did not plant that. There's nothing written down. That was a perfect answer.
But that's the reality, and I can tell you from literally thousands of people on hormone replacement at Buckeye, people love it because it makes you feel young again.
Right.
And at the end of the day, who doesn't want that? It not only makes you feel young, it helps you heal better. And and I always say, feeling good is a symptom of being healthy. And feeling like garbage is a symptom of not being healthy.
Right.
So how do you feel?
And on that note, how can they, if somebody's interested and they want to talk to you, how can they get a hold of you at Buckeye?
Probably the easiest way is just go to the website, which is Buckeye, P as in Paul, M as in Mary, R as in Roy, the PMR.com, and check us out. You can call in, get a free consult for hormones, stem cells, or whatever else you may or may not need. And when's the last time we heard of a free doctor visit? We don't even charge to come in. And the reason we don't charge is we don't know if we can help. But you'll come in, we're servants of information, we'll give you the information you need. And if you want to do it, great. If not, that's your choice. But at least you know.
Right.
You got nothing to lose.
And if you get to Dr. Buzz,
I'm there on occasion.
Yeah, when he is there, he's not going to let you escape until you know all the information. I know that for a fact.
You know,
Get your blood work done. Get your blood work done. I get it.
So, yeah, but definitely check out the website, BuckeyePMR.com. You don't have to feel bad. You don't have to be in pain. This I am sure of. We see miracles happen every single day. We've helped thousands and thousands of people. You know, and I just want to help more people. So definitely check us out. Just trying to think if there's anything else to add. So we talked about stem cells today. We talked about hormones.
I think we covered. We went all in on stem cells today.
Was a good one. All right. All right. Well, once again, check out the website, BuckeyePMR.com. Until next time.